What does it mean for a community to be healthy? It's more than doctor visits. Health is shaped by our food, safety, support, and access to care. In southern New Jersey, Rutgers researchers and a local healthcare group set out to truly listen to the people of Cumberland, Gloucester, and Salem counties. Through surveys, focus groups, and interviews, they gathered stories and data from hundreds of residents and local leaders. This wasn't about outsiders prescribing solutions. It was about empowering the community to define its own path to better health. By bringing everyone to the table, the project built trust and set the stage for real lasting change. South Jersey is a diverse patchwork of communities, each woven together by unique histories and demographics. From its bustling towns to its serene farmlands, the region presents a fascinating study in contrasts, each with unique strengths and challenges that shape the lives of its residents. Understanding these nuances is crucial for effective community development and resource allocation. Cumberland and Salem are predominantly rural, characterized by sprawling agricultural landscapes and close-knit communities. This often translates to fewer doctors and longer drives for care, creating significant barriers to healthcare access for many residents. The distances can be a real challenge. Gloucester, in contrast, is more suburban, with denser populations and a greater concentration of amenities. This suburban setting generally means better access to healthcare facilities and a wider range of medical services. In Salem, the disparity is stark. There's just one primary care doctor for every 4,000 residents, highlighting the critical need for increased healthcare resources. This is a significant difference when compared to Gloucester, where the ratio is approximately one doctor for every 1,000 residents, showcasing a much more accessible healthcare landscape. Uninsured rates are highest in Cumberland, adding another layer of complexity to the healthcare challenges faced by its residents. In Cumberland, where 14% of adults lack coverage, the financial burden of healthcare can be overwhelming, preventing many from seeking necessary medical attention. This high rate of uninsurance makes care unaffordable for many, exacerbating existing health disparities and creating a cycle of unmet needs. These differences mean each county needs its own tailored approach to address its specific healthcare needs and challenges. What works effectively in a Gloucester suburb, with its readily available resources, simply won't work for a Salem farmer who faces geographic and economic barriers. By understanding these local realities and appreciating the unique context of each community, the team could ask the right questions, delve deeper into the root causes of health disparities, and ultimately find solutions that truly fit the needs of the people they serve. Tailoring strategies to each county ensures recommendations are practical, relevant, and ultimately more effective in improving the health and well-being of South Jersey residents. The community's voice was clear, resonating with a unified message. Their greatest strength, without a doubt, is collaboration. They believe in the power of working together. Local groups, faith organizations, and nonprofits are actively working together, forming a strong network of support. They are dedicated to uplifting the community. But the biggest barrier, the challenge that casts a long shadow, is the high cost of living. It's a weight on everyone's shoulders. When families struggle with housing, when the roof over their heads becomes a source of constant worry, food or transportation becomes a luxury, not a right, health inevitably takes a back seat. Preventative care is skipped, and chronic conditions are left unmanaged. Over 75% said financial stress directly impacts their well-being, casting a dark cloud over their daily lives. The mental toll is significant. Nearly a third delayed or skipped necessary medical care due to cost, a heartbreaking decision with potentially dire consequences. And rural residents face extra hurdles, navigating transportation challenges that isolate them from essential services, and provider shortages, leaving them with limited access to the care they desperately need. People also long for stronger social connections, a sense of belonging that combats the isolation many feel. Safe spaces to gather, support each other through thick and thin, and build a stronger, more resilient community. Health isn't just about treating illness with medicine. It's a much broader concept. It's about connection, unwavering support, and a deep-rooted sense of belonging within a community. The message real health means thriving together, supporting one another, and ensuring everyone has the opportunity to flourish, not just merely surviving. Residents didn't just share problems, they offered solutions. They want healthcare brought into their neighborhoods, clinics in community centers, libraries, even food pantries. One-stop centers could offer medical care, food assistance, and job support all under one roof, making help accessible and convenient. People want care that sees the whole person, not just symptoms. Providers who understand their lives and challenges. Trust and partnership are key. Stronger collaboration among agencies, nonprofits, and faith groups can create a seamless support system. Residents urged leaders to use these findings to advocate for funding and policy change. The path forward is clear. Build bridges, not silos. The real impact of this assessment, the true measure of its success, is in the action it inspires. It's about turning data into tangible improvements, fostering a proactive approach to well-being within the community. The healthcare organization is already using these insights, leveraging the information to make informed decisions, to shape a multi-year plan focused on a comprehensive strategy designed to address the community's most pressing needs. Easing financial burdens, providing support to those struggling to afford essential healthcare services, improving access, ensuring that everyone, regardless of their location or circumstances, can readily obtain the care they require, and strengthening community ties. Building a network of support and collaboration that promotes collective health and well-being. Findings were shared widely, through reports, flyers, and community events, so everyone can use the data, empowering residents to take control of their health and advocate for change, to push for policies and initiatives that address the root causes of health disparities. Community presentations and virtual sessions kept the conversation going, ensuring that the community's voice remains central to the ongoing efforts, building trust and momentum, fostering a sense of shared ownership and commitment to creating a healthier future for all. This project proves that listening, truly hearing, and understanding the needs of the community leads to real solutions, to effective strategies that address the unique challenges faced by the community, and a healthier future. A future where everyone has the opportunity to thrive and reach their full potential. By keeping residents' voices at the center, by prioritizing their experiences and perspectives, South Jersey is actively constructing a new model for community health. A model that is responsive, equitable, and sustainable. The journey continues, the work is far from over, but the blueprint is set. Real change starts by listening and acting together. It's about collective effort, a shared vision, and unwavering commitment.